Hi everyone, Dr. Danesh is here from Canadian Academy of Anti-Aging Medicine from Canada. In my past video regarding under-eye puffiness, dark circles, and wrinkles, I talked about non-cross-link hyaluronic acid and amino acid combo injections and how they could help under-eye skin and bags. In this video, we will find out how often this injection should be done and the difference between these kinds of injections and cross-link hyaluronic acid fillers. Also, whether facial fillers, including under-eye injections, have healing power or they're just a filler. According to this article from Johns Hopkins Medicine, from facial plastic and reconstructive surgery, dermal fillers can help achieve a smoother, fuller look in facial skin that has lost volume due to aging. Administered by injection, dermal fillers can also address the appearance of acne and other scars, fine lines, deep wrinkles, and hollow areas. However, we didn't know that these fillers, which is hyaluronic acid base, cross-link hyaluronic acid, or non-cross-link hyaluronic acid, has any effect on the fibroblast regeneration and proliferation, which makes our skin healthier, tightened, and rejuvenated until now. Here is a study published in 2013. And the title is Comparison of Non-Cross-Linked and Cross-Linked Hyaluronic Acid with regard to efficacy of the proliferative activity of cutaneous fibroblasts, which is the main cells in our skin, and keratinocytes, which is the cells on the surface of the skin in vitro, which means out of the body. So they basically trying to understand if non-cross-link or cross-link hyaluronic acid has any healing power in cell regeneration in our skin when it actually injected intradermally. So as you can see here, intradermal application of hyaluronic acid in a varying chain length and cross-linking density is used routinely for hydrodynamic volume replacement of the extracellular matrix to reduce the clinical effects of aging. So what they already know was that in vitro data show that via receptors of the hyalid heterin group, hyaluronic acid has additionally direct or indirect effects on cells. In the case of native non-cross-linked hyaluronic acid, it has been proved that the proliferative and metabolic activity of cutaneous fibroblasts, which is the main cell in our skin as mentioned before, can be increased. The aim of this study was to investigate whether these effects can be proved also for cross-linked hyaluronic acid and how these effects can be quantified for different preparations. So they concluded hyaluronic acid that was stabilized in the carboxyl and hydroxyl groups per inner esterification induces the strongest proliferative effect on both cell types. Native non-cross-linked hyaluronic acid and chemically cross-linked hyaluronic acid show a rather modest proliferative effect and on fibroblasts only, whereas non-cross-linked hyaluronic acid with added glycerol in high concentrations provokes a rather anti-proliferative effect. So in other words, as long as we have the carboxyl and hydroxyl groups per inner esterification, it could induces the strongest proliferative effect as mentioned, so it shouldn't be the glycerol one. Therefore, the more fibroblast proliferation in our skin, the more elasticity we have, because the end product of each fibroblast, each active fibroblast, would be 2-glycoaminoglycan, elastin, and collagen, which make our skin healthier and younger. In this before and after pictures, which is from Johns Hopkins Medicine website, as you can see, there are puffiness here under eyes, and then here as well. And then after injections with non-cross-linked hyaluronic acid in this area, they have been able to resurface the under eye puffiness to certain points. As you can see, there's still a little bit of puffiness right here, but it's a lot better than before picture, as you can see. In this picture, which is one of my patients, under eye tear trough and dark circle, and also nasal fold and other sides with volume loss under the malar bone, and also in this area as well. So after injection of proper product, which is cross-linked hyaluronic acid and non-cross-linked hyaluronic acid in different area, we reach to the after picture, which is this one. So because the non-cross-link or pure hyaluronic acid has only 20% of filling effect under eyes, which the maximum we need in that area, according to the studies that we just mentioned, it could activate the fibroblast here and here to increase the elasticity in this area and the thickness of the skin, and also increase the connective tissue under the eyes to be able to, first of all, resurface the tear trough itself and make the skin thicker, so less dark circle, obviously, because the more transparency of that skin under the eyes, the more dark circle appears in that area. But how often we should inject the non-cross-link or pure hyaluronic acid under the eyes? So basically, between 4 to 6 weeks of the first injection under the eyes or around the eyes, even on the crow's feet area, we should ask the patient to come back to get the second injection around the eyes to be able to give the patient the best product and the best result as well. The fibroblast gets activated because of the hyaluronic acid injection, and as mentioned before, it creates a great elasticity because of more glycosaminoglycan, elastin, and the collagen, and increase the thickness of the skin in that area. So first of all, we can get rid of the puffiness and tear trough with the pure hyaluronic acid under the eyes, and even in other areas such as nasolabial fold, with cross-linked hyaluronic acid, we can get a great result by filling that area intradermally or even subdermally. And as mentioned before in that study, cross-linked or non-cross-linked hyaluronic acid could increase the number of fibroblasts, meaning that it has the proliferative effect on the fibroblast, which are the main cells in our skin, to be able to make more collagen and elastin. So we ended up having a healthier skin, first of all, and the younger skin for sure, because it could increase the elasticity and the number of baby cells and new cells to the surface and intradermally, which is inside the skin. Hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friend and families. And like always, stay happy and healthy. Thanks and have a great day.